Begin gastric occult blood testing by reviewing the patient's history for GI bleeding or other GI disorders, and for drugs that can cause mucosal bleeding in the GI tract. Perform hand hygiene. Ensure privacy and introduce yourself to the patient.
Hello, my name's Laura. I'm your nurse today.
Then identify him using 2 identifiers. If the patient has a nasogastric tube or NG tube, verify its placement before taking a sample. To obtain a specimen from a nasogastric tube, first disconnect the tube from the suction or gravity drainage. Then, attach a bulb or catheter-tip syringe to the tube and aspirate 5 to 10 milliliters of fluid. If you find red blood or coffee ground material, report your findings immediately to the healthcare provider. Reconnect the tubing. To perform the gastro-occult test, use the bulb or catheter-tip syringe to apply 1 drop of the gastric sample to the test slide and pH test area. Then, apply 2 drops of the developing solution over the sample and 1 drop between the positive and negative performance monitors on the slide. Within 30 seconds of applying the solution, verify that the performance monitor has turned blue. After 60 seconds, compare the color of the gastric sample with that of the performance monitor. Any trace of blue in the test area is considered positive for occult blood. A green test area means the sample is negative. To obtain a specimen of the patient's gastric contents from the emesis basin, use a wooden applicator or a 3 milliliter syringe to put it on the test slide and pH test area. Follow the manufacturer's instructions for testing. Again, any trace of blue in the test area is considered positive for occult blood. A green test area means the sample is negative. Dispose of the test slide and the wooden applicator or syringe. Remove your gloves and perform hand hygiene. If the test is positive, report the results to the healthcare provider. As part of your follow-up care, continue to monitor the patient.